Recovery after a major illness, injury, or medical treatment like surgery or chemotherapy depends on repair and regeneration of damaged cells. These newly formed cells taking over the function of damaged cells make recovery possible. The basic need for repair and regeneration of cells and tissue is optimal nutrition, gentle stimulation, and protection from toxins. Healing and repair activities of the body are controlled by the omega-3 fatty acids derived eicosanoids and docosanoids. Cell activation support for the convalescing patient with the optimized nutrient food high in omega-3 fatty acids strengthen the immune functions and regeneration of cells. An adult body is composed of around 50 trillion cells. A number of cells are dying every day and new cells replace the old ones in a systematic way. Cells associated with the protection of our body like white blood cells, lining of the air passages of lungs, gastrointestinal system, urinary tract are replaced every 2 to 5 days. Our immune system has two functions. One is defense and the other is healing. Defense functions of the immune system is called inflammation and is mediated via omega-6 fatty acids derived mediators called eicosanoids. Healing function of the immune system is mediated via omega-3 fatty acids derived mediators called eicosanoids and docosanoids. For healing and recovery, replacement of damaged cell is the most crucial part. Damage to the cells occur as a result of infection, injury, or due to toxic exposure. Anything other than a nutrient, including the drugs, are taken as medication, or a nutrient in excess quantity is a toxin, and they reach each cell of our body through the blood. Recovery from any illness depends on our body's ability to repair or destroy the damaged cells and replacing it with fresh cells. Nutrients are the building blocks of cells. There are 54 non-nutrients needed for the function of the body, which include oxygen, water, protein with 18 amino acids, fat with 4 fatty acids, carbohydrates, glucose, dietary fiber, 14 vitamins, and 14 minerals. Life is a chain of chemical reactions. If the raw materials, the nutrients, are available in the correct proportion, the chemical reactions needed for life will go smoothly. A deficiency or excess of nutrients or the presence of a toxin will negatively affect the functioning of the cells and the health of the body. We get the nutrient oxygen from air and all other nutrients from our food. If the food is deficient in one or more nutrients, or if the food contains one or more nutrients in excess, or it is contaminated with toxin, it can damage the cells. Nutrients, once absorbed into the body, reach the cells via blood. Blood flow to an organ or cell depends on the stimulation or activity level of that part of the body. Metabolic waste from the cells are removed via blood. So, for an easy and fast recovery from an illness, the most crucial aspect is ensuring optimal nutrition, stimulation, and protection from toxins. In cell activation treatment for recuperating patients, optimized nutrient composition support ensures all nutrients in the correct proportion for the regeneration and repair of the cell, and high content of omega-3 fatty acids, the healing agent, strengthens the immune system. Oxyflex, the gentle activity protocol, supports healing by increasing the blood circulation and thereby ensures nutrient reach to the cells. An effective removal of the metabolic waste and accumulated toxins in the cells and interstitial fluid also takes place. Cell activation treatment helps to control blood sugar in diabetes and thereby faster and better wound healing after surgery or injury. Easy control of hypertension and dyslipidemia helps to recover the cardiovascular disease and stroke. Optimized nutrient oil massage stimulates the nervous system and support recovery from stroke. High omega-3 fat, optimized nutrient food supports recovery from nerve injury and degenerative diseases of the nervous system. With cell activation support, diabetes medication can be stopped on day 1 and other medications can be tapered off slowly. Medications increase the workload of the excretory organs and immune system. With cell activation support, we can reduce the medications and this will reduce the workload of kidney, liver, skin and mucous membrane and help in recovery from the renal disease, liver disease, skin disease, mucosal damage of the gastrointestinal tract, respiratory system, etc. Finally, when the body is in a recovery phase, least stress should be there on the digestive system and cell activation nutrition, which focuses on avoiding any preservatives, flavors, colors, etc. has a distinct advantage in quicker recovery.